Oh, all right, thank you. So we are able to start our recording. So as I've already mentioned, substance use disorder is a treatable mental health disorder that affects the person's brain and behavior. It involves the inability to control the use of substance, including legal and illegal drugs. So somebody may say, oh, alcohol is not a drug, or the prescription drugs that they continue to use, even though their need is no longer there, is not a drug. So far as you are unable to control the use of this particular medicine, you are nearing the diagnosis for, how do you call it, substance use disorder. One thing about substance use disorder is that sometimes it can co-occur. Talking about co-occurring means it can exist with some other conditions. It's not always that the substance use will bring these conditions. It can be that the substance use actually brought it about, or those other conditions brought about the substance use, or they are living on their own with the person. So these are so talking about co-occurring mental disorders. Individuals with substance use disorder frequently experience other mental health disorders. Each complicates the recovery process and treatment process. So the person can be depressed, and the depression can bring about the substance use disorder, or the reason why the person is abusing a drug can be because the person is depressed. At the same time, because the person is using the drug, it makes them depressed. There are enough anxiety disorders can equally be present. Bipolar, whichever form of mental illness can co-occur with substance use disorder. So that's one thing we should know. So if an individual is exposed or implicated to drug use, they can experience other mental health conditions in addition to the substance use disorder. That's one thing I would like us to know. Let's take some key definitions over here. So when you talk about substance use, you're talking about the consumption of alcohol, drug, or other psychoactive substances. Substance abuse, the harmful or the hazardous use of the psychoactive substance, which includes alcohol and then illicit drugs. And when we talk about, there's also something we call substance dependence. So where the individual finds it difficult to stop, despite they know that this drug is affecting them, it's having an effect on them. They can really see the physical signs that the drug is affecting them, but they are finding it difficult to stop. Then you are talking about substance dependence. That's a condition where the individual persists in use of substance despite problems related to the drug use. And then we have what we call addiction. So when it develops into what we call addiction, at that point, it becomes a chronic condition. And talking about chronic conditions means something that can live with you for a longer duration. And also, it becomes a relapsing condition. Relapsing here means that you can manage it. It will look as if it is gone, but it will come back again. That is what we talk about relapsing condition. So when it comes to addiction, so it's a chronic relapsing disorder characterized by compulsive drug seeking. So at this point, it's like it comes as a compulsion, it's an urge that is making you to go for it. Even if you just finish taking it, in a few minutes, like that urge comes again, and an urge that you find difficult to control. Also talk about compulsive usage of the drug. And then, despite the harmful consequences that is bringing to you, and this can be long lasting and may have a lot of effect on the brain as an individual continues to use these drugs. So there are different categories of substance that people abuse. Different categories. So you have the depressant. So this depressant, what it does is that they reduce the arousal and stimulation levels or feelings in the system. So arousal means that kind of energy you get to do things, stimulation, the zeal or the enthusiasm to do something. Depressant in itself goes to reduce this arousal and stimulation aspect. An example of depressant is alcohol. Somebody will say that they want to take alcohol to get energy to do something, but I want us to understand here that alcohol is a depressant, which rather reduce the work of the nervous system. The energy that you're looking for, it rather reduce it. It will make the nerves more relaxed than excited. So using alcohol that you want to gain energy from it will rather not give you that, but rather give you reduce energy, because you are saying that the depressant to reduce the arousal level in your system or your stimulation levels. They also have, we have the barbiturate and then the benzodiazepines. Then the opposite of the depressant is the stimulant. So the stimulant here, they will increase the arousal level for you, and then the activities in the brain. So they will rather give you that kind of energy that you were expecting to use alcohol for. The stimulant rather do that. So stimulant increases arousal and activity level in the brain. So caffeine, nicotine, cocaine, amphetamines, and all those ones, they are all stimulants. Then we have the opioids. So primarily, opioids are pain relief. So they are meant to relieve us of pain. So if you are going through some excruciating pain, usually they prescribe an opioid for you. So like the morphine, the tramadol, those painkillers, here all opioids. And the main goal behind the opioids is to reduce pain or to relieve you of pain. That is, and now the red that is being abused also falls under opioids. So you understand that this is also one class or category of psychoactive substance. Then we have the hallucinogens. So with these ones, when they go into the system, they goes to alter your perception, your way of thinking. It goes to have an effect over there. And it's like you start feeling some way. And that's where some kind of feelings will come into the system. And your behavior may not go as expected by society. And then finally, you talk about the cannabis or the cannabinoids. So the marijuana and all those synthetic cannabinoids, what they do is that they give you that high feeling. And also, they also alter your perception. Talking about altering your perception, it alters your way of thinking. So the way you feel, the way you see things, your understanding of things will all be altered. That is what it's talking about. Alteration of perception, that is what it means. So either your sense of vision will be altered, hearing will be altered. That's what how do you call it, hallucinations as a result of that, because the drug goes to alter your perception. Let's listen to a brief documentary here. Let me see. Okay. Please, can the sound be heard? In American terms, we call it an opioid. So these opioids, they are medicines made to relieve pain. So they are. Please, can you hear the sound? Hello, can you hear the sound of the video playing?
Not audibly.
Let me see. Pain relievers. But however, is it clear now?
Yeah.
All right, thank you. The red is, in American terms, we call it an opioid. So these opioids, they are medicines made to relieve pain, so they are pain relievers. But however, the red in particular that you're talking about is an illegal drug because it's not a licensed drug. Sometimes some companies rebrand and put other labels on it. That how come we have the red that people are mentioning here. But it's an opioid. It's a high grade of tramadol. So the red is tramadol in an advanced form. That is basically what it is. And because of its effect in pain, it also produces some euphoria, some high feeling or some excitedness in people when they take it. And then some of them take it because they feel it will help them work. It will give them the energy when they are stressed out and they take it. They're able to manage their stress very well. But the statistical figures in drug use among the youth from ages of 15 to 25, per the Ghana Health Service statistics, about 11% of this year group is abusing these drugs. It's always on the increase. It's actually an issue that we should be concerned as.
He has the woman anybody no already.
There are a lot of health challenges. Okay, so aside the mental health challenges that we may be talking about, they also have physical health challenges. So it have a lot of effect on their organs, on the liver, on the kidneys, on their lungs, on the heart itself in general. Okay, and then the mental health effects are just enormous. When these drugs go into the system, it goes to control our reward system. There are chemicals that control how we feel reward. So when it goes in there, it goes to make the person become addicted. And once you're addicted, it means that the individual will wish to actually want to stop doing the drug, but they find it difficult to stop. So once this thing happens like this, the person will be always be chasing this high. And one negative effect is that when a person, the day they didn't get, there's something called the withdrawal symptoms. And that makes it even difficult to stop, because once the drug is withdrawing from the system, it makes you feel sick. It makes you feel so weak that you don't have any interest in doing whatever you do. And life becomes so miserable when you are withdrawing from the substance. Yes, so honestly, what I would like to encourage people who are on this drug is to stop. You know, it doesn't add anything to your life. The euphoria you are feeling, the high feeling you are feeling, that sweetness you are feeling, is because there is an effect on the brain. That's how come you are feeling that. So if you want to continue chasing that feeling, it's going to lead you to have a severe mental health and other physical health challenges. So I, as a brother, to whoever is listening to me, I just want to tell you that this drug is not good. I think that's the best abstinence from this drug. And you who haven't started already, don't start it. Don't try that, because when you start, stopping becomes very, very difficult. All right, so I hope we've heard what red entails, which is an opioid. Let's look at other craze that is also going on in drug use arena.
Why would anyone try and get high of human bones?
That's what the message that I'm getting here. That the breaking of the grapes here is about that.
It's about what?
About taking bones and make kush.
In Sierra Leone, a new drug is turning young people into zombies. They call it kush, dried leaves mixed with a cocktail of chemicals. As the impact of Africa's worst drug epidemic deepens, disturbing reports have emerged about the newest ingredient, human bones. We have come to one of the main cemeteries in Freetown because we are told that local communities are forming groups to stop the grave robbers. They are called Friends of the Dead.
We have many destructions. Even this is other. There is not even remains inside here.
Oh, this is another one.
Yeah.
Come here.
Inside, come here.
So the coffin and everything is there, but they just took the bones.
Yeah.
Wow.
Taking it. The bones.
They're taking the bones.
Yeah.
How many graves destroyed you said?
More than 1,000.
More than 1,000 graves.
1,000.
Despite the work of David and his friends, even the dead aren't safe from the Kush crisis. At the country's only mental health hospital, Dr. Jusu Matia has seen the recipe change over time.
You know, it's an ever-changing phenomenon. One time you hear they have added formalin, before you know it, they have added something else. But the recent substance that has been added now is the human bone. Human bone contains a lot of sulfur, and sulfur has the potential of giving you that feeling of high, especially when taken in at high concentration and when inhaled, because it goes directly to the brain.
Why?
All right, so welcome back from that short documentary that we've just viewed. So you realize that now people are abusing things that previously was not even known. To the extent people are using human bones all just to chase the high. Now it is red, previously tramadol, and all those things are still in existence. And one thing about this red is that it's not that it is something so new. It's just that we now know that this is there, or somebody has to blow the whistle. But it has been a system. That's why it is almost in every aspect of the country. So, per research statistics, you are saying that the prevalence of substance use in Ghana is reported to be 12.3%. And out of that percentage, 56.9% are abusing or are using alcohol, whilst 26.4 are using cigarettes. Those are the most common. However, all the other ones, the weed and all those ones, are equally abused. Additionally, statistics from the Narcotics Control Board indicate that 50,000 drug users in Ghana are 35,000. That's a student of 35,000. So taking 50,000 people who are abusing drug, 35,000 of this number, that's according to JGMF, a 2024 research, is reporting that out of 50,000 people who are reported to be abusing drug, a huge 35,000 of these numbers are students. So which means the youthful age now is in danger, because if this number, more than half of this research data is telling us this, then there is a cause to be worried about drug use and its issues in the country. So from that research, JGMF's research, some reasons they gathered for people abusing drug, some says for fun, but they just take it just to have fun. And some use it as aphrodisiacs, so to be able to get the energy to perform sexually. Both males and females are all using these things or drugs in the means to get sexual energy. And some reported that because of low self-confidence, because of maybe shyness, low self-esteem, they feel they cannot perform. They use these drugs to be able to perform. So to deal with their anxieties. And some also, you see, now based on how drugs or alcohol, for instance, is being advertised, it is made to look as though using alcohol improves your social status, because they use some of these big celebrities and stuff to advertise this thing and make it look like an ideal thing to do, or to say that you are a worthy man or woman, you should be using some of these things. So some people take, based on the research, some people take these drugs to improve their social status, because they feel if they're able to buy the most expensive drug, it makes them, let's say, rich, if I should put it as such. And from that studies, looking at there's a pie chart at the right side, you're looking at the age bracket and the level of drug use. So you see, between 15 to 29% is 35% of the total population of those who are using drug. And then 30 to 44, which is the most productive years, is leading with 41%. Then you have 45 to 59, 15%, and then old age, 60. But one thing we shouldn't forget is that even below 15 years are also abusing these substances. These figures is just based on someone's research, but you should also know that people 12 years, 13 years, 10 years are even abusing drugs. So we should know about that. And as I mentioned already, to Substance use disorder goes with some co-occurring disorders or other conditions that can co-occur. This co-occurrence, I explained earlier that they may be with the person while substance use disorder is also the person, or one can be bringing the other. So that the substance use is what is bringing about the depression, the post-traumatic stress, the schizophrenia, bipolar, and the rest. Or these conditions are the ones that are making the person to now go into the substance use. However, they can coexist in the person. So as you are managing someone on substance use disorder, you also look out for some of these things. The list here is not exhausted. These are just few that we can be talking about. And what are some of the risk factors? Some things that prone people to abuse substance. So sometimes family history of addiction. So in some families, you realize that the prevalence of substance use, especially alcohol and the rest, is on the increase. Maybe as the children are growing, they are learning from the senior siblings, from parents, from aunties, from uncles, and they grow and they continue in that cycle. So it can be a family history. At times too, socioeconomic deprivation, financial challenges. So the person is so broke and feels that they can only make friends with drugs. So socioeconomic deprivation or being broke financially or financial distress can also be a risk factor to somebody to abuse drugs. Homelessness has also been reported to be one of the risk factors where the person doesn't have a place to stay, so society is not very friendly to this person. Unemployment, poor working conditions, and job insecurity, all these factors. So you realize that people who do these things mostly fall within these categories. And then research is also making us understand that men are more likely to use illegal drugs compared to females. Well, maybe because of the risk-taking behavior of men. And then also, poor mental health is linked to drug misuse and vice versa. So there are strong links between health inequalities and drug use, but as I said, this is just summary of some of these things. So if you are using drugs or some of these substances, know that it can have an impact on the brain. So what are some of the specific impacts that these drugs can have on the brain? But before that, one statistic is telling us that over 60% of individuals who have been treated with substance use disorder experience relapse within the first year, indicating the chronic nature of the drug. So as we are saying, addiction in itself is a relapsing condition. Relapsing condition means you can be in treatment or in recovery and fall back again. And you're saying that about 60% of people who are in recovery has the tendencies of falling back again. And why is it happening? So when we go forward, we get to understand the science behind some of these things, why it makes it difficult for them not to avoid relapse. So when someone is abusing drug, we are saying that some of the effects include cognitive changes. So the person's attention span capacity will all be altered. Their level of concentration will all be altered. We talk about declining cognition. As we mentioned earlier, that substance use can alter somebody's perception. Once your perceptions are altered, it will definitely affect your cognition. So your ability to judge, your ability to plan, your ability to make decisions, all these things will be compromised. Memory effects will be there, where forgetfulness and all those stuff will be coming. Even processing speed, how you're able to process, maybe if they ask a question, you quickly just get the answer, or if you want to do something, some activity I want to do, how fast you can do those activities. When substance use start having effect on the body, whereas that your processing speed reduces. So how the brain used to be sharp and can do things as fast no longer comes like that. How you are active and you can just start, even if it is about running, you can run as fast as possible. This time around, all those things become difficult. Visual-spatial inabilities, so your level of seeing and all those stuff, your speech and language all can be affected when you abuse drugs. So let's see, there's just one of these TikTok videos about someone who is abusing drug, and let's see how the effect is having on this person. This talking about decline in cognition. Now you are not able to even think to know that this is that. Someone seeing this stagnant water and thinking this is Milo drink. Oh God.
Hey, yeah, some more. Yeah, say what is happening? Good. It's terrible. Seriously.
So that is what drug use can bring about to an individual, where your cognitive abilities will be distorted, and your way of life to the person, it's normal, it's okay, but to society, we know that that is not how a person should be. You can't go and sit by a stagnant muddy water and consider that to be your Milo drink. God should have mercy on us. And then behavioral changes as well. So these persons start to neglect their responsibilities. They're going to work, going to school, whatever they are supposed to do, taking care of their families. They start neglecting their responsibility, including their personal hygiene as well. So this person is not hasn't bathed, not wearing slippers, or all these things can all be affected. And one thing that makes addiction very dangerous, I mentioned that in one of the video or the documentary on the red, that the withdrawal, tolerance and withdrawal makes addiction difficult to treat, because when the person is addicted and they are withdrawn, the withdrawal means the substance wearing off the system. So maybe if the person didn't get some to take the whole of today, you realize that by evening, their body is craving for. So if this person wants to stop even using a drug and they didn't get, the withdrawal set in. So as the substance is wearing off the system, the person feels some unusual feelings. Sometimes they even feel sick, tremor, sweating profusely, and all those that getting angry or easily irritated. All these things will be coming to the person. And this is what will make the person forced to go and get a drug again. So tolerance and withdrawal behaviors makes it even difficult for recovery. And engaging in risky behaviors, neglect of physical appearance, as I mentioned, physical health declines. So drug it's not only about the mental health issues it's going to bring to you. Cardiovascular issues, that's heart-related issues, are all there that can affect you. And your liver, all your body organs are all compromised. If you continue to use drug, if you are using alcohol, your liver, it's like you can't run away from some of these things. Now, kidney diseases are on the increase, and all these stuff. Sometimes substance use can account for some of these things. Speech changes. So rather, this person is talking, and now they are as if their tongue is not in position. How they are talking, their speech are slurred, and all those stuff. You'll not be able to understand what exactly the person is doing. Sometimes even they tend to withdraw from society. They don't feel like interacting because they are feeling shy. They now feel less of themselves. They rather be in their own corner than interacting with people. They feel people don't understand them. People don't like them. Social media and all those stuffs the kind of thing to be posting on their social handles, all these things can be having effects on them. So it's like a cycle, okay? Addiction comes in form of a cycle. So according to this researcher, so it is saying that, so when taking from the first stage, so you have the reward system of the body, okay, of the system of our brain, which the amygdala, the dopamine, and all those stuffs are involved. So the reward system is overstimulated when the drug goes into the system, resulting in a lack of control and binging. So the aspect of the brain that controls our reward system. So reward system here means that the part of the brain that will tell that, oh, this thing is good, so do it again. This thing is bad, don't do it again. That aspect of the brain, if the drug goes into it goes to bind with it and makes it to be overstimulated. It makes it to be overstimulated. And once it gets overstimulated, it now makes it difficult to control the use of the drug. Now it is always inviting it. It's always inviting it. And then a long-term exposure to this drug will increase the dopamine receptors. And this will require more of the substance to be going into the system. The amygdala is also implicated in this stage. So let me explain this very concept in a very simple, with a simple scenario. So let's take, let's say, a car battery and then an acid on a car battery. So the cell itself is the amygdala. So that's the cell, which is the powerhouse. Then the acid on it is the acid that charges the cell. So the acid here is the dopamine, which is the chemical. So this dopamine is supposed to charge the amygdala for it to function. Now, let's assume the dopamine or the amygdala needs 5% of dopamine to be able to function on a daily basis. So what happens here is that now if you take in this addictive substance or this psychoactive drug, it goes to increase the strength of the dopamine, which is that the neurotransmitter dopamine. It goes to increase its strength over there, and as it increases it, it ends up charging the amygdala more. So let's say from that normal level of 0.5, maybe a one roll of weed, we move it to, let's say, 0.6 or 7. Meanwhile, the amygdala just needs 5 to operate. So when it becomes 7 like this, the energy becomes so high. It becomes so high, so the person tends to enjoy the feeling that comes with it more. So as they are enjoying the feelings with it, they want to maintain it. So it will get to a point where that new feeling will no longer become anything wow again. I'll be glad if you are not speaking, if you can mute your microphone. Thank you very much. So it will get to a point where this 0.7 no longer makes the person have any new feelings again. So they may want to increase it again. So from that 0.7 now, they'll now double the number of rows they take in a day or the frequency at which they take it, so that they can either maintain that or increase. So as the more they increase, the more new excitedness comes into the system. So with that scenario, now limit is a bulb. Electric bulb needs 240 volts to function. Now, if this current has gone up, let's say to 500, at times this bulb can blow. Someone is playing music. Can you please mute for us? Ooh. Adam Sabina, please, your background. Thank you. All right. So as the current overflows, the gadgets may blow. So this equally happens the brain system. So as the stimulation of the dopamine is getting overly excited, it start having effect on the parts of the brain. So that is how it goes. And because of that high feeling, that's why you keep enjoying it and you want to do it more and more and more and more. So you are saying that people who are addicted have a compulsive need to engage in addictive behavior. So that the part of the brain that is affected as the frontal cortex and the hippocampus are thought to be affected by the drug abuse. And these aspects, if your frontal cortex is affected, because these are aspects of the brain that controls our executive functions. And talking about executive functions, I'm talking about your ability to plan, your ability to decide, your ability to make judgment, all these things. So if the aspect of your brain that helps you to make decisions is affected, then it means that you can't take decisions again. If the part of the brain that is supposed to help you make judgment, to know that this is good from bad, and that part of the brain is affected, then you are not able to judge between good and bad again. If the part of the brain that helps you to plan that, okay, today I'll do that, tomorrow I'll do this, I have to do this, I have to do that. If that part of the brain is affected, then you are not able to plan again. So anything goes. So all this will become compromised as you continue to use the drug. So this is just a summary of what I said. So as we said, when a person takes the drug or engages in other addictive activities, the neurotransmitter dopamine is released in the cluster of nerve cell called nucleus accumbens, blah, blah, blah. And then the hippocampus will respond to the dopamine by recording memories of pleasure, and the amygdala creates a conditioned response to the stimuli like the cigarette, the weed, all those things that they take. Meaning that when the person sees these cues, they will have an intense craving for the substance or activity. Repeated exposure causes nerve cells in the nucleus accumbens and the prefrontal cortex, which is concerned with planning, that's executive functions, to communicate in a way that leads the person to seek out the drug or activity and want to do it more. So over time, the person gets used to the feelings of pleasure they get from taking the drug or doing another addictive activity, and so they need to do it more and more and more just to get the satisfaction they want. And then they say, oh, they have a hard time feeling happy when they are not on the drug or doing the activity they are addicted to. So the times that they don't get the drug, it becomes a difficult moment to them. So they must get it to be able to keep on being well. So as I mentioned, the drug don't only affect the brain, it affects other aspects of the body. So I mentioned organ damage is there, your liver, your kidneys, your lungs, and all aspects of the brain, of the body organs can be affected. Respiratory issues, so difficulty breathing, chest enlargement, and all heart issues, all those types. Then neurological impact, as I said, the cognitive. So some of these things can, if the person does these things in their young age, they grow dementia and all those types, forgetfulness, memory difficulties may be setting in. Weakened immune system. So once your immune system is also compromised, realize that any infection at all, so even the slightest thing you fall sick because the body is no longer strong enough to fight diseases any longer because the drug has gone to reduce your immune system. So even if it is someone that will cough close to you, you also start taking that cough and you cough. Anything that comes. Nutritional deficiencies, the person will have difficulty even eating this time around, that they will not even have interest in eating. Research has also shown that there can be dental issues with the teeth, and pain sensitivity. So some people, when they are addicted, they no longer sense pain. So even something, whether you are cutting them or something like that, they really don't feel pain like that. And because the drug is having effect on their sense of pain, and all these things, you tell that something is wrong with the brain. So in conclusion, exposure to people, places, or things previously associated with substance use can serve as a trigger. So as you are saying, people who are addicted, if they go to places where people drink, been seeing other people doing this thing, even if they are in recovery, and they are exposed to people, places, or things that previously make them drink, if they get more exposure to some of these things, can be a trigger for them to fall back again, or use that to promote substance seeking and taking, even in people who are in recovery. So you are saying that one thing that can equally help when you talk about management, but before, I think by slide, I skipped the management aspect. One thing I want to also let us understand is that from the definition we said, substance use disorder is a treatable mental health condition. So which means that it can be treated. So anyone who may be on this call that is battling with any drug use, you have to seek help. Seek help from any mental health professional. We have people who are specialized in addiction management. If you didn't get a specialist, still approach a mental health facility and you'll be helped. So addiction can be managed. So as you are saying, but one thing too that can support with the management is social support. So families should also support, and this can help. So the importance of family support, peer support groups, and community resources in recovery cannot be overemphasized. As we said, the coexistence of substance use disorder and mental disorders presents unique challenges for treatment and recovery. Effective interventions must simultaneously address both the coexisting condition as well as the main substance use disorder. So I would like to pause here, and if you have any questions, you can ask. Thank you very much. All right, please, if anyone have any question, you can unmute and ask. Or you can equally drop your message in the chat box where it will be read out. All right, I think so far, yes, I can see your comment in the chat appreciating the presentation. I'm grateful, Esther, Evans, Madam Sabina, and Texin is asking if the slides can be shared, so we can talk about that after the presentation. Yes, the presentation has been recorded as well. Okay, so Helena is asking, how do we help students with addiction whose parents are not ready to support? How do you help somebody whose parent, but the question is, Helena, if you can unmute and let's talk. If is the student, him or herself, willing to seek help, that is one thing we should look out for. If the student himself is ready to seek help, let's connect this person to the facility. Once the person is connected to the facility, the person can, the help process will start from there. So, or you can equally connect and let us see how we can help this very person. But it is possible.
Okay, so my question is about the students having a challenge, and then the environment as a whole being against us difficult for them. So the home has now become the time of strength to the child because the book process began and then the way to proceed into the
I don't know,
family rather than
Madam Helena,
finding
I think we are not hearing you very well. If you can maybe speak up a bit for us. Can you please speak up a bit? We couldn't hear you very well.
yes, so I'm saying that
Yeah,
is it clear now?
yes.
As I'm asking where the client's home is rather the traits. And we cannot remove it from that environment because that is where she belongs. How do we support her? Because she goes into the withdrawal and then kind of going back anytime she goes for holidays and something. That's it.
Okay, so I think we also have rehab. But depending on the assessment, so I think the very first thing is to get this child assessed by a professional in a nearby facility. And look, based on the assessment, either a rehab, since the environment is not conducive for this child to recover properly, maybe a rehab may be considered for for this child, where at the rehab they're able to manage the withdrawals as well and other issues that may happen. So I think the very first thing is let us get this child to a health center. So that is what I can say. But maybe if someone else have a different opinion or addition, you can add on. Thank you.
Yes, so she has been assessed. She has been assessed to be assessing people. And now the challenge is with the home in the sense that both parents are not ready to help in
Okay,
terms of
okay, okay,
financial
okay. So
work coming and so the process of taking her to the grave house needs the consent because it's underage.
okay. But you can also
So we need
link
the
this child to the social welfare department. You can link this child to the social welfare department, right? Now that you've identified the challenge and the support from family is not available. You know, mental health workers work with social welfare department as well. So if some of these social challenges are coming in between the work, you can involve social welfare. Social welfare can come in and even get the parents of this child to support. So, or they may take it up as government to assist this child who is into this. So social welfare can also be involved in this very child care. But maybe I think you can link up after this program and let us look at it in holistic terms. Yeah, thank you.
Hello.
Yes, Mr. Emisa,
Yes, so if I may contribute to the question,
very well.
I think with mental health, this is a major problem, and the parents not willing to assess borders on this whole big case we're talking about stigma. The parents, maybe because the child had been stubborn or whatever, they are reluctant for whatever reason. So this is where the therapist or the teacher or whoever is involved should engage the parents and talk to them, get them understand, because they're also part of the bigger problem. So whatever way you can get them to understand that this child, even though for whatever reason, if it is drug and whatever, yes, had done that to himself, but their stance, not getting the cooperation or the support, makes the whole thing bigger and difficult to manage. So that if they are willing, they are able to get on board, then with professionals involved in this, and there could be a way out. But we can't do without parents' consent or society's consent. Otherwise, it becomes very difficult managing mental health. And unfortunately, mental health is a situation whereby sufferers, once they begin to suffer illness or go on that tangent, they lose income. You don't earn income. Your productivity becomes zero or goes towards zero, and therefore it becomes financially difficult to manage. But they need help, the help of society. They need the help of all of us, because the price as a society we pay will be bigger. So it is in our common interest as a society, as community, as parent, family, to help in the management of mental health. Thank you very much.
Yeah, thank you very much. And you've said it. Please, is there any other question or concern, contribution from anyone? The floor is opened.
Please, can I come in?
Yes, please.
Just if you can throw a little light on the management of withdrawal when they are on withdrawal symptoms or they're showing any withdrawal. How do we manage it, especially if they are brought to facilities and in the course of treatment, you begin to experience withdrawal symptoms? How do we go? If you can throw a little light on that. Thank you very much.
All right. So management of withdrawal symptoms can come in two forms. The pharmacological way, that is with the help of medications, and then the social support system. We can use these two to manage the withdrawal for the person. So maybe a first step will be the detoxification process. So that is, which is medicinal. So the detoxification process is where medications are used to help detox or remove the chemical in the blood of the person. So that is one way that you can. And then we also have some vitamin supplements, some medications that also helps to reduce or it goes to replace the feeling they get from the drug. So like some medicines like the thiamine, these are some medicines that can be used and mostly used by the psychiatrists. So as a psychologist or with people, how do you call it? Psychotherapists, you don't do the prescription. A psychiatrist is supposed to do these prescriptions. So there are medications that can be used to replace that cravings for the person to help manage the withdrawal symptoms. Then aside that, monitoring or getting support, a mental support system is very necessary, because sometimes the person is willing to stop, but as you mentioned, if the brain structures are affected, it becomes difficult to do these things. So we need the social support so that they can serve as reminders to the person. As the person is trying to go out, the system in there to help control the person from going out. So these are some other things that you can equally do to help these people. And then sometimes even we have what we call the other play therapies or activities that will get a person engaged. Activities that the person enjoys doing. So when the person enjoys doing, you try to identify that And then based on that, you get a person to be doing some of those. Some people may like to write, some people may want to do some other activities, maybe guys, maybe footballing, and try to identify things they enjoy doing, and then you let them channel their energies towards some of these things that they do. And group therapies also help, or group sessions can also help these people a lot. So individuals and then group sessions can help for them to, so as they learn about their withdrawal symptoms, it helps them to know when it is coming and what to do. So we must also teach the clients to know about the withdrawals. Sometimes some of them, they are withdrawing, they get angry. So we also teach this person anger management techniques to help manage some of these things. But I think most important, the family support is really, really, really important, because recovery process without family support can be very, very challenging to the individual. So some basic things, especially talking about anger management, teaching the person some skills like assertiveness, all this can help with, how do you call it, withdrawal management. But the very first major thing is medically. So medically, you use the medications to detox, and then also support the person with the medication that will help manage the cravings, and as well as, and we also mentioned the co-occurring conditions. If you are not, sorry, if you are managing just the substance use and trying to say you want to prevent relapse or you want to prevent withdrawal, and you're not looking at the coexisting mental health conditions, that can be affecting the recovery process. So if there is depression, if there's anxiety disorder, which is not addressed, those things can trigger the person to go into the drug use. So that's why it is necessary to identify the coexisting mental health condition that is there. Manage it as along the substance use disorder that you are managing. So you're able to do it like this. It also helps to let me say, prevent some of these things. And then there is some how do you call it, self-monitoring, maybe check assignment you can give to the person to be, at the end of every day, they're able to write how their day went. They'll check, ensure that the whole day they didn't take, what kept them away. Even if they felt it, they should be able to record it that they felt it, but this is what they were able to do to overcome it. Giving some of this assignment to the people also help them to manage the withdrawal. So it is not a one-way fit thing. It depends on the individual and what they are presenting with. That will help you to know what particular focus to use to help these people. I don't know if I've been able to touch some part of, but if others have suggestions to add, you are free to do so. Thank you.
Thank you.
And please, do you have any other concerns, questions, contributions? We have a lead psychologist for the Ghana Growth Project join us, Madam Anita. You are most welcome.
Thank you very much.
We are glad to have you with us. And maybe if you have anything to share with your group before we call it a day.
Okay, maybe another time. I'm a bit late today, so the next time I join.
All right. Thank you very much. So as I
Thank you.
mentioned, Madam Anita Awuya is the lead psychologist on the Ghana Growth Project, MasterCard Foundation Ghana Growth Project. And this webinar is part of the project where we have small groups that we interact on regular basis with. And my group, the leader is Madam Claudia, our host. So thank you for the opportunity to engage with you, and thanks to everyone who joined. Drug will definitely destroy our bodies, so we shouldn't even start. If you're already in it, seek help. Just let me also share the mental health authorities toll-free number with you. If you're having any challenge and maybe reaching out, going to the clinic, maybe you are not able to do so, you can equally call the mental health authorities toll-free number. Someone, it's a 24-hour number, so someone will always be available to speak with you over the phone. It's free. You are not charged credit in calling the number. So I'm going to mention it. Write it down, save it on your phone. Anytime you have any emotional or psychological distress, you can dial into the number. So it's 0800 678 678. 0800 678 678. That's a mental health authorities toll-free number that you can always call, and someone will definitely respond to you and maybe lead you to a support system. However, with our on-site lead psychologist also with us, you can equally reach out to her at any time and she will be available for you. And with my group members, yes, we can always interact and we'll see the way forward. So I want to thank you once again, and God willing, next week, hopefully we'll interact again. Yeah, bye for now.